From KVUE News in Austin, you're watching Texas This Week with Ashley Goodo.
Good morning. After the deaths of 3 Texas mothers, we are getting a first look at the bill aiming to save the lives of pregnant women who need abortion health care. We sit down with State Representative Donna Howard in just a minute, but first, let's get to the 3 things you need to know in Texas politics. The Texas Senate passed a bill banning the sale of all consumable hemp products that contain THC. THC is the chemical that makes a person high. Right now, it's legal to sell hemp products just as long as THC levels are not more than 0.3%. Senate Bill 3 would ban those products, but still allow the sale of hemp products with CBD and CBG to adults. The bill does not affect the state's compassionate use program, which allows doctors to prescribe low amounts of THC to patients with certain medical conditions. The bill now heads to the House. The Department of Justice is moving to dismiss a lawsuit against Texas over a law that allows state and local police to arrest people suspected of entering the state illegally. Governor Greg Abbott signed Senate Bill 4 into law in 2023. It has not gone into effect because of court challenges, including from the federal government. The Biden administration fought the state, saying the law is unconstitutional and intrudes on the federal government's responsibilities. A trial was set for July, but the Trump administration filed paperwork this week to dismiss the case, along with similar cases in Iowa and Oklahoma. Texas Attorney General Ken Paxton filed charges of illegally performing an abortion against a Houston area woman. According to the AG's office, Maria Rojas, a midwife, ran 3 clinics in Waller, Cypress, and Spring, where staff falsely presented themselves as licensed medical professionals and performed abortions. 2 men are also charged. Legal experts say this is a case they're watching closely because it could challenge the constitutionality of the Texas Human Life Protection Act. That law went into effect in 2021 and makes it a first-degree felony to perform an abortion that results in the death of a fetus. In 2022, with the overturning of Roe v. Wade, it became illegal for doctors to perform abortions in Texas unless a woman's life was in danger or she was at risk of losing a major bodily function. In the months that followed, numerous women experienced complications, some losing their fertility, others their babies. And at least 3 women died after being denied abortion health care. This legislative session, Texas lawmakers have filed bills to clarify, stating doctors can use their judgment and not wait until a woman is on the brink of death to treat her. The Republican bill is getting bipartisan support, including from Austin State Representative Donna Howard. She joined me to talk about her support of the bill. Representative Howard, thank you for your time today.
Thanks for having me.
You know, the Life of the Mother Act was filed, and this week we heard from faith leaders from across the state who were really rallying behind this legislation. Talk to us about what the bill does.
Well, what it does is it actually clarifies when a doctor can use their reasonable medical judgment to intervene when there is a medical complication for someone who has a pregnancy. It's an exception to the abortion legislation that has been passed that was preventing doctors from intervening as they normally would have prior to the legislation to address the needs of moms with complications. This allows for the doctors to use their reasonable medical judgment, so it protects the doctor-patient relationship. But the bottom line real thing it does is it's going to save the lives of Texas moms. And that's why so many of us are behind it.
Yeah. Let's take a step back for just a moment. So up until now, the law that was passed says a mother has to be, or a woman has to be at risk of losing a major bodily function or, you know, having the life-threatening complications for an abortion to happen. And that has really caused a lot of confusion.
Yes. Part of the confusion has been around the fact that doctors and hospitals were interpreting this to mean that the woman had to be, death was imminent for the woman. The courts have ruled that that's not the case. The Texas Medical Board has clarified that that's not the case, and now this legislation is clarifying. You do not have to be on the brink of death, but you do have to have a life-threatening situation occurring, or something that could impact major bodily functions. And that can also mean, according to this legislation, future infertility, which was one of the complications that we were seeing happening to women because of the delayed intervention that they were receiving.
We've seen women not only lose their ability to have children in the future because they were not treated with the proper abortion health care. We've seen women, mothers dying.
That's right.
In this state because of this.
That's right. And, you know, we were told after this legislation, the original legislation came out, the prohibition on abortion legislation came out, that it was clear to many of the legislators. They felt like it didn't need to be clarified. But I think over time, what has been evident, as you mentioned, is that we have actually seen women have died. Texas moms have died because they did not get the medical care that they needed. And when you look at that, you think, well, why didn't the doctor intervene? Well, the law was written to where if the doctor intervened and had somebody question their judgment, they could lose their license, they could pay over $100,000 in fines, and they could actually go to prison for life. Huge criminal, civil penalties, as well as losing their license. So the new legislation that's just been filed, that I'm supporting, removes those penalties. So no longer are doctors being placed in the position of having to be threatened with these consequences. They can actually use their reasonable medical judgment and practice medicine the way they have been taught to practice medicine.
Mm-hmm. And again, one thing that I think is really important that we want to be clear, there still has to be a medical emergency. This does not allow abortion in the state. This
is not a choice bill. This is not going to address some of the issues that I and others would like to see addressed. It does not provide an exception for rape and incest. It does not provide an exception for fetal abnormalities unless somehow that fetal abnormality is impacting the life of the mother. And I'm talking about some physical impact on the mother. And unfortunately, we're not including mental health impacts, which definitely could be there. But it does specifically address any physical impact that would have. But bottom line is, it does not include all of those things. It is not a choice bill. It is a medical bill. It is about exceptions for medical emergencies, and that is a step forward. One of the reasons that I am supporting it and encouraging all of my colleagues to support it is because we want to be doing things that actually protect the lives of Texas moms. This is the most significant piece of legislation that we could have right now that ensures that we will have medical care for all moms who have medical pregnancy complications, and we will save Texas moms' lives.
Talk to us about some of the other legislation that you have that you're working on this session that you would like to see passed.
Oh my, there's so many.
There's a lot. I know that's an open-ended question.
I would just say that as chair of the Women's Health Caucus, I think our overarching mission is to ensure access to health care. Mm-hmm. And one of the things, going back to looking at childbearing, in Texas, over half of our births are paid for by Medicaid. To get Medicaid coverage, though, you have to be pregnant, which means that you have to know you're pregnant, which can take a few weeks at least and after you've become pregnant. Mm-hmm. Then you have to apply for Medicaid. Then you have to find a provider. And you've lost critical developmental time there for making sure that the infant is getting what it needs, at that point a fetus is getting what it needs to develop appropriately. And that the mom is getting the kind of medical interventions that she needs to control her hypertension and her diabetes. Bottom line is, we don't cover you in time to get some of those things taken care of in a timely fashion. We did expand Medicaid postpartum coverage from 2 months to 12 months, which was good. Mm-hmm. But the medical issues can occur beyond 1 year. So my bill I'm calling it Healthy Moms, Healthy Babies, is that we provide Medicaid extension. I'm not calling it an expansion, an extension of what we already have for all women of childbearing years. So we already cover youth up to about 19 years of age. So I'm talking about around 19 years of age to 45, 50, whatever we agree on is the span of time that is basically when you can have a baby. And we have continuous coverage for those women so that they can get healthy before they get pregnant, which ensures a much better outcome for them and for their babies. And also continue the postpartum coverage so that they can continue to get treatment beyond 1 year for any of their chronic conditions, as well as space their pregnancies, have access to the contraceptive care they need, because spacing pregnancies also has provides positive outcomes for babies.
Yeah. I hear you. I hear you talking about this bill. This sounds very good. This also sounds like it might be a tough sell in a Republican-led legislature.
You know, there perhaps to a certain extent, but you know, I think we've seen that we have a bipartisan legislature that wants to see healthy moms and healthy babies. And I think that's something that the anti-choice legislation really brought to the surface with the criticisms that the legislature had gone too far. And indeed, I think there's been kind of a pushback on we've gone too far by showing how much we do support moms and babies. So I'm leveraging that in any way I can.
Yeah.
But I sincerely believe that most of my colleagues want to see healthy moms and babies, healthy families, and that we want to do whatever we can to support that.
The Senate version of the bill, SB 31, is referred to the State Affairs Committee, and the author of the bill, State Senator Brian Hughes, is the chair of that committee, increasing the chances of the bill getting a hearing. The House version, HB 44, is referred to the Public Health Committee. Of course, we will keep you updated on the bill's movement. That's Texas This Week.